So from my observation, your sound is better than the way it was earlier today. Okay, so I want to welcome you to our class for today. This is our second time today. This is part two of the final test, of the midterm test. I guess we will get right into it and we will start the test immediately because of time. We just have 1 more hour to finish. So for this section, we will finish the speaking tags first. Then the main tags, we will have to do it now because this is the second part. So we're just going to do everything that has to do with the test, okay? So we will continue with our speaking task. So just give me a minute. I will commence asking questions. So earlier today we completed part one, okay, of the speaking challenge under the main topic medical appointment. Okay? So we will continue. Now for part two, we will look at a sample conversation. Okay? I'm going to do a quick display and we will talk about it together. Now, you will look at the scripts, okay? Then we will have this same conversation without the script, okay? So I'm going to share my screen now with you, and we will look at this sample conversation together. Then we will have it without the script. We will talk about it. So for part two, we're looking at a basic conversation. And I will carry out the role of the doctor's receptionist. Okay? While you will take up the role of the main character. Okay? Now, this is the hypothetical story we will talk about. The story now, please listen. After having lunch with Miss Glenn yesterday, your body starts to show symptoms of the flu. You remember that the flu season is coming, so you decide to call the doctor's office to do a quick health check and also to get a flu shot. Okay? So remember, you are the main character and I am the doctor's receptionist. Now, these are words we expect you to use for this tax. I've been wheezing. I've been coughing when you talk about symptoms. I feel dizzy, nauseous. I have pain. I need to make an appointment. I wonder if I might be able to get. I really appreciate it. These are phrases for you, okay? Now, I will ask you questions and I will tell you, I would respond by saying, let me check. Let me see if I can fit you into my schedule. And would you be able to come at a particular time? Okay? So this is where we're going to stop with this description. You have a flu. You need a flu shot. You need to talk to me in order in order for you to book an appointment with me. Okay? And I am to help you book that appointment. Okay? So let's begin. Okay? So I'm going to give you a minute to think about your ideas on this while we begin. Okay? Okay. Okay. So you're going to act with your phone as if you're calling me. Okay? Okay? So you're going to pick up your phone and act as if you're giving me a call. So let's begin. Okay?
Hello.
Okay, so hold on. Are you done? Are you ready?
Okay, I'm ready.
Okay,
Let's
that's
start.
good. Okay, so let's go. Just a minute, please. Please hold on.
Mhm.
Please- Okay, sorry, I had to take care of the interruption affecting the
Mhm.
class. Okay, so let's begin.
Hi.
Hello?
Yeah, this is Aurora. I need to make an appointment with Dr. Dorcas.
Oh,
I wonder if
hello.
yeah,
Hello, this is Dr. Starr's office. How can I help you?
yeah. After my lunch today, my body start to have some symptoms of the flu, so I need have checkup and maybe I wanna take a flu shot.
I'm sorry, please. I did not get your name. Could you please tell me your name?
Yeah, my name's Aurora.
Okay. Hello, Miss Aurora. My name is Dorcas. I am the receptionist at Dr. Starr's office. How may I help you?
Yeah, uh, after having lunch today, I have some symptoms that maybe of the flu. So I think I need to make an appointment with a doctor who can test my health checkup. And I think I need to take a flu shot.
Okay. So when do you need me to book this appointment?
Yeah, I wonder if I may be able to come in early on tomorrow.
Okay, so you'd like to come in tomorrow, but I'm so sorry.
Yeah.
We're fully booked for tomorrow. Can um
Mm,
can I fit you in um on um on a Friday this
Friday.
week or
Uh,
next week,
so
please?
yeah. So could I come in on? Could I come in the morning?
Yes, yes. The doctor is available in the morning.
Yeah. So um, how about from 9 to 10, from 9 to 10 o'clock at the
Okay,
morning?
just give me a minute. Let me see if I can fit you in for 9 to 10 a.m.
Yeah.
Okay, from my records, 9 to 10 p.m. is currently free. So I'm going to book you
Mhm.
in for 9 to 10 p.m.
Yeah, yeah, that would be perfect. Thanks a lot.
So we'll see you then. Please do not miss your appointment.
I really appreciate it.
You're welcome. You're welcome. Thank you very much.
Yeah, bye bye.
Okay, goodbye. Okay, so that was a very nice simulation of the doctor's appointment. Good job. Now we will move on to the next part. And this part is called um, the advanced part, okay? Is the
Yeah.
advanced part. Now, this part, we will talk about what you require when you get to the doctor's appointment, okay? So you just booked your appointment, okay?
Mhm.
Now,
Mhm.
the next simulation has to do with you talking
Mhm.
about the way you feel, okay?
Mhm.
So we're going
Yeah.
to the next level now. So I'm going to share my screen with you briefly, and I will we will quickly look at some requirements, okay? So for this appointment, you remember you are the main character, okay? You
Yeah.
are the main character and you just booked for an appointment to see the doctor. And you did this because you want to have a health checkup, right? And you want to take a flu shot, which is also known as a vaccine, right?
Mhm.
Okay. Now, this time you're going to call the doctor's office again, okay?
Yeah.
And this time you want to arrange for the flu shot, okay?
Okay. Okay.
Okay. This time you're asking for the flu shot. When can I come in for
Mhm.
the shot? I met the doctor and he said I should come pick a date to come for the shot, the vaccine. Okay. So now you want to book an appointment to take the shot. Okay.
Mhm.
Good. So now this time you are going to negotiate with the receptionist on the number of hours it will take for you to get this shot. Okay? Okay, so I need to arrange for your second appointment. We've arranged
Mhm.
for your health checkup. Now we
Yeah.
want to arrange for your flu shot, the vaccine you need
Yeah.
to take. Okay? So
Yeah.
you're going to call again for the second time and you will ask that I schedule you for a particular timeline for you to get the
Mhm.
flu shot. Okay? Now, if you look at the screen, this is your schedule. Monday, you're
Yeah.
busy all day, and Tuesday, you're free from 9 to 12. On Wednesday, you're free from 3 to 5. On Thursday, you're free from 9 a.m. to 2 p.m. And on Friday, you're free from 1 p.m. to 5 p.m. You need to talk to me now. You need to let me
Yeah.
know when you are free
Mhm.
for the shot and when you are not free for the shot. Is that okay?
Okay.
Okay.
Yeah.
Then I will share with you the timelines that are available. Okay.
Yeah.
So I'm going to tell you the flu shot takes 1 hour, and these timelines are the timelines available.
Yeah.
Okay. We're available
Mhm.
on Monday. Sorry, on Monday, we're busy all day. On Tuesday, we're available from 9 to 10 a.m. On Wednesday,
Mhm.
we're available from 1 p.m. to 5 p.m. On Thursday, we're available from 10 a.m. to 12 p.m. Okay, then on Friday, we're available from 4 p.m. to 5 p.m. So we need to agree on a timeline where you are not busy and a timeline when the doc or the whoever is to attend to you is available. Okay, so
Yeah.
we're going to do this with the second call. So are you ready?
Yeah. I'm ready.
Okay, so let's do this now. So you're calling in again. Okay.
Ring.
Okay, ring, ring, ring. Hello.
Mm.
This is Dorcas from the doctor's office. How may I help you?
Hello, this is Aurora again. I have just taken appointment for a health checkup. So this this time I want to ask about the time for taking a flu shot.
Okay, so you would like to book a time slot for your flu shot. Okay,
Yeah.
okay. Please give me a minute. I will quickly check to ensure
Mm-hmm.
we fit you in. But you need to know that the health checkup takes 2 hours, please. The flu shot takes
Yeah.
1 hour, while the registration and other things will also take 1 hour. So we need you to ensure you are available to us for at least 2 hours. And
Yeah.
we have currently on Monday we are not available because we're fully booked. But on Tuesday
Mm.
we are available from 9 a.m. to 10 a.m. only. While on Wednesday we are free from 1 p.m. to 5 p.m. On Thursday, we are only available from 10 a.m. to 12 p.m., while on Friday,
Yeah.
we are available from 4 p.m. to 5 p.m.
Okay. So, um, is that okay if I take the blue shot on Tuesday from 9 9 a.m. Is that okay?
Oh, I'm sorry. On Thursday, we are not available
No,
at
no, on
9 a.m.
Tuesday.
On Tuesday.
Tuesday.
Okay, on Tuesday.
Yeah.
So on Tuesday, we're available at 9 a.m. to 10 a.m.
Mhm.
Yes.
So, can I ask a question?
Yes,
Uh,
please.
do I need to have breakfast first? Then
Yes.
then after that I take a blue shot.
Yes, for this vaccine, it's important you have your breakfast first. So please ensure
Yeah.
you've eaten your food first before coming to the hospital.
Yeah.
Okay.
So, is that would be perfect. I will come at 9 a.m. on Tuesday.
Yes, you're booked for 9 a.m. on Tuesday. And please remember the timeline for the shot is 9 a.m. while you have to come 1 hour earlier in order to
Yeah. Ah,
okay.
okay.
Yes.
So I need to come in 8
Yes.
a.m. right?
Yes,
Oh
please.
my God. I have a little bit busy on 8 a.m. So um, you mentioned that on Wednesday we have we available from 3 to 5, right?
Well, on
3
Wednesday, we are available from 1 p.m. to 5 p.m. So if you are available from 3 p.m. to 5 p.m., I could book that slot for you.
Yeah, that's good. That's perfect. So could you please change my timeline to Friday? I will come. I will come at 1
We just
p.m.
we just agreed for Wednesday.
Okay, I'm so sorry.
Okay.
Wednesday. So
Okay.
okay, yeah, yeah. Wednesday I
Yeah.
am
So
available.
so this
Yeah,
is your confirmation that Wednesday is a good day, right?
yeah, yeah. Okay,
Yes.
that's
Okay.
good.
So I'm booking you in for Wednesday from
Mm, okay. I
3
will
p.m. to
come.
5 p.m., right?
Yeah, yeah.
Wednesday, 3 to 5 p.m. Okay.
Yeah.
Okay. So we're looking forward to having you over at our facility by 3 to 5 p.m.
Thanks a lot.
Okay. Thank you very much. See you soon.
Yeah.
Okay. Goodbye. Okay. So that was interesting. Thank you very much for simulating the doctor's appointment with me. Okay, so that brings us to the end of part two. Okay, now we will move to part three. Okay,
Mm,
and in part three, I'm going to ask you some questions. And these questions require that you give full explanations. Okay,
mm,
good. So I have about 10 questions. So please take your time and explain to me fully. Okay. Question number one.
yeah.
What are some of the reasons why people schedule medical appointments?
Again, please.
I'll take the question again. What are some reasons why people schedule medical appointments?
Yeah, whenever person is not good in health, can you hear me?
Could you repeat yourself? I did not get what you said. Please repeat yourself.
Yeah, can you hear me now? Can you hear me now?
I can hear you, but the sound is not clear. Are you using a device?
Yeah.
Can we just talk without a device? Let's see if it's going to be clear.
Okay, now can you hear me?
Perfect. Perfect.
Because there are many sounds around me, so
I
but it's
think
okay.
this is clear. This is clear. Good.
Okay, okay.
Okay, so I'm going to take the question
So
again one more time. What are some reasons why people schedule medical appointments?
um, yeah, some reasons that people schedule a health appointment. Um, First of all, I think it's because they don't feel well. Yeah, and they have some symptoms that make they feel uncomfortable. Yeah, and the second, I think because they think they are sick. Yeah, and they want to make their health better by taking by taking advanced advisement from the doctor.
Okay, thank you for your answer. We'll move on to the next question. How do you think advancements in technology have influenced the way people schedule and attend medical appointments? How do you think advancements in technology have influenced the way people schedule and attend medical appointments?
Mm, I think modern technology is very important in um, taking giving advice in health appointment because um, it's a kind of saving time for the patient um, to meet directly the doctor. Yeah.
Okay, thank you for your answer. We move on to the next question. My third question here is, in what
Mm.
ways can the healthcare system improve the process of scheduling and attending medical appointments? In what ways can the
Yeah.
healthcare system improve
Mhm.
the process of scheduling and attending medical appointments?
Mhm. So some ways that the health center uh, can improve their service in a health checking. I think um, with improving the modern technology, so the health center can make the short time um, to connect to patient and the doctor by, for example, by telephone. So the health center can get some symptom before the patient come to the center and meet the doctor, and so that the doctor can have some organized organization about the patient's symptoms, so that it's better for the doctor to give the way for treatment.
Okay, thank you for your answer. We're going to move on to the next question. How do cultural beliefs and practices affect people's attitudes towards seeking medical care and scheduling appointments? I'll take that again. How
Mm.
do cultural beliefs and practices affect people's attitudes towards seeking medical care and scheduling appointments?
Yeah. Uh, could you please
Rephrase.
repeat the third times?
Okay, so I'm going to rephrase the question now. Now,
Yeah.
you know, in the society, we have the way,
Mm,
a lot of people have different beliefs about going to
mm,
the hospital for care.
mm.
Yeah. So this time,
Yeah.
we want to know how these beliefs affect them when they sick, when they need help, especially medical help, and when they talk about booking appointments. Are they receptive to this idea of going to the hospital? Do they want to do
Mm,
this? How do they behave when you tell them, oh, we're booked and you have to come back on another day? How do you
mm,
think cultural beliefs and practices affect people's attitude towards seeking medical care and scheduling appointments?
mm. How to um I understand the question, but I temporarily don't have much idea to answer the question.
Okay. So I'm going to give you an example. For example,
Yeah.
we have some
Mm-hmm.
religions that believe
Mm,
that taking medication is not
mm.
spiritual enough to heal you.
Ah,
Okay.
yeah,
We have some
yeah.
beliefs that traditional medicine is better than
Mm,
the orthodox medicine you get from the hospitals. So the
yeah,
question
it's
here is
really.
saying, how does this belief affect the way people approach scheduling appointments at the hospital and how they go about seeking for medical care? That's the question.
Yeah, yeah. According to your example, um, I think it's uh, the that belief of us for some religions that um, traditional treatment can affect too much on seeking other treatment from the hospital, because some people believe that they can use herbal treatment instead of seeking for a doctor who was studied a lot in modern technology, in modern education, um, to um, to give better. method, yeah, to give better methods in treatment, and so that's it's very difficult for the doctor if to rearrange, no, to re definite, yeah, to make the patient to break the belief of the patient and follow the doctor's treatment.
Okay. Okay, thank you for your answer. We will
Yeah.
move on to the next question. It says, can you discuss any challenges that individuals may face when trying to schedule medical appointments? Can you discuss any challenges that individuals may face when trying to schedule medical appointments?
Yeah. I think in some countries, it's not easy for people, for patients, to take medical appointment because of the timetable of the doctor. But in Vietnam, it's very easy. Yeah, it's more easier than other countries to have a health checkup appointment, because I think it depends on our culture, that doctor need to cure need to cure any patient that come to the hospital. So, for example, when I need a health checkup and I call to a health center, and then they immediately reply and give me a shorter nearby timetable to immediately get the method. So I think it's good in medical health in Vietnam.
Okay, so now aside booking an appointment with the hospital, how about the
Yeah.
cost of the medical care? Is it
How about what?
the cost for the care?
Other
Is
cost?
it free?
Yeah. Uh, Sometimes not free all the time, but it's I think to taking appointment in Vietnamese hospital is really a good quality in price, more than other countries, for example in US or Europe. Yeah.
Okay, so you believe there are no challenges with making
Yeah.
appointments here in
In
Vietnam.
Vietnam.
Okay, so thank you
Yeah.
for your answer. We're going to move on. It says, what role do healthcare providers play in ensuring that patients can easily access and schedule medical appointments? What role do you think healthcare providers play in ensuring that patients can easily access and schedule medical appointments? So, what role have you seen them play over time?
Um, what role? Uh, um, I think um, in medical center, right?
Yeah,
Um, mm,
I'll take the question again. So, for
yeah.
example, the hospitals,
Mm.
what do they do to ensure that as a patient, a person can easily access medical care? What are the things they've done, or what are the things they're currently doing that help to facilitate contact between the patient and the hospital?
Mm. I yeah, let me think in some minutes.
Okay,
It's a very hard question. Yeah,
take your time.
yeah. Uh, can you give me some example?
Okay, so for example, um, the Tan An Hospital in Ho Chi Minh City. It's a
Uh,
veteran hospital. They have an
uh-huh.
emergency center, and they have
Yeah,
an ambulance that can pick up a patient from their location in case a person has an emergency. This
yeah.
is one of the ways you can help people locate the hospital by
Mm,
providing them with easy transportation at a
mm,
cost,
yeah.
right? Now, what other
Yeah.
ways can the hospital make it easy for patients to get to them in order to book appointments or to get health care?
Uh, so I just I just share with you about Vietnamese culture, Vietnamese hospitals. Yeah, uh, there are a lot of apps, medical apps that very very simple for people on around the country that can take a health appointment online. And no need to call to use telephone to call the healthcare center. Um, and I think the uh, this one of the most modern technology that applied in healthcare in healthcare center. That's really good. Yeah,
Okay, thank you for answering that. We will move on to the next question. How do you think that COVID-19 pandemic has changed the way people approach medical appointments and healthcare in general? I'll take the question again. How do you
yeah.
think the COVID-19 pandemic has
Mm-hmm.
changed the way people approach medical appointments and healthcare in general?
Yeah. As I have just mentioned, that a lot of medical apps and now can help many people to take a appointment with the distance. No need to come immediately to the hospital anymore. Uh, just with some normal symptom of sickness, we just use the app. Maybe, and we have a lot of AI doctor that can instantly answer the question from the patient. So maybe they don't need to go to the hospital anymore. Yeah, it's take time, it save time, save the money, and it's quality. It's a kind of quality treatment. Yeah.
Okay. So thank you for your answer. We'll move on to the next. What are some strategies that can help reduce wait time and improve efficiency in medical appointment scheduling? What are some strategies that can
Mm-hmm.
help reduce wait
Mm.
times and improve efficiency in medical appointment scheduling?
Uh, yeah. Uh, so yeah, I think I have just answered. My answer is in the previous question, right?
Yeah,
Yeah, for that reason. Yeah.
but you need to repeat it again this time
Okay.
in context
Yeah.
of the question. Yeah.
Yeah, luckily that after the COVID-19, because of it's better for people to keep the distance, so many apps can improve and help patient a lot to save their time in taking medical appointment, um, and even save money. Yeah. So this also help doctors a lot to reduction the sickness, and they have uh, a method that's suitable for the patient before the patient come to the hospital. Yeah.
Okay, thank you very much for your answer. We're going to move on to the next question.
A lot of questions.
You have two more questions. Okay, so do you think telemedicine,
Mhm.
do you think telemedicine and virtual
Mhm.
appointments will become more common in the future? Why or why not?
Second time, please.
So you just talked about mobile applications, robot
Okay.
AI consulting
Yeah.
patients on behalf
Okay.
of doctors. You just talked about
Okay.
that. You talked about
Yeah.
phone calls. You talked about booking appointments online and everything. Now we're
Yeah.
saying, do you think these methods will become
Yeah.
more common in the future? If you think so,
Yeah.
tell me why. If you don't think so, please tell me why.
Ah. Yeah. Yeah. I totally agree that uh, the mobile app can be more common in modern world. Yeah. In case of health um, health no health service. Yeah. um, and
Go on.
yeah. Because of its very advantages, there are a lot of advantages in using mobile apps on medical services, um, and it's I think it's um, can be more effectively can be more effective. Yeah. And help doctor on and also help doctor a lot. um, yeah, and maybe it's reduce the amount of patients to come to the hospital. Yeah.
Okay. So thank you for your answer. We're going to move on. The last question for this section before we move to the next. How can individuals take proactive steps to manage their health and schedule regular medical checkups? So, how can individuals take proactive steps to manage their health and schedule regular medical checkups?
Mm. Yeah, although modern technology is developed, developing on medical services, patient should be taken regular health checkup because I think it's better for people to keep their health in keep their health in the best. Yeah. uh, so it's also maybe I think whenever people come to the doctor, they will get some more education about medical and the method to keep they are in good health by themselves. Yeah.
Okay, so thank you very much. We've come to the end of the second, the third part of the speaking test. Okay, so you did great with this. You really did great with this. Good job. So without wasting time, we will move to the next part. Now here, I'm going to share with you a link.
Mm-hmm.
Okay, it's a barcode and a number. So you will have to log in with this. You can just scan with your phone. I will share my screen now, and we will begin the next task. Now, this is the main task where you have to answer questions, okay? They are quick questions, okay? And these questions will cover everything you've learned from the first part of our classes, okay? So
Yeah.
can you see the barcode on the screen?
The yeah.
Yeah. So you can just scan this with your phone and
Yeah.
you can join and this will begin. Okay. So you have two devices connecting.
Um, oh,
Is that you or someone else? Okay, I can see.
Aurora.
Okay, I have two more people here. I don't know how they got here, but it's okay. So we're gonna start the quiz. I want you to answer the questions, okay? And just do your best, okay?
Mm-hmm.
Okay, so
I'm still waiting. Yeah, still
yeah, so
waiting for the host to start.
yeah, so I'm gonna click start now, and we will.
Yeah.
Okay.
Yes. So
So are you done? Almost done?
finish. Yeah,
Okay. Keep going.
stressful.
You're doing great. I think you're done, right?
Yeah,
You're done. You're done already. Okay.
yeah.
Okay. So how was it?
Yeah, I'm experiencing is very good in the test. Yeah,
Okay. Okay, just give me a minute.
yeah.
Okay. Okay. So hold on. Okay, just a minute. So I must say we're very fast. That's good. And I was really impressed seeing the green dots on the screen. It really showed that you took out quality time to study, and I'm super impressed. Good job. So
Really? I don't think
yeah,
so.
yeah. So I observed there were some questions you got wrong there, but there were
Yeah,
few of them. So
yeah.
it just lets me know that you put in a lot of effort, and we will look at those questions. So would you like to look at those questions, or do you want me to book another timeline? In our next class, we look at the corrections and we take it up from there. What would you
Uh, um, if you can, I think it's better if I receive the like a summary of the
like?
test is
Good.
okay,
That
and
would be
then
nice.
I will, yeah, I will correct myself.
Okay. You'll review them and correct yourself. Good job. So we've
Yeah.
officially come to the end of the midterm tests. So you have taken the listening test, you have done the speaking test, and we have done the final round with the questions. Okay. So I have a question for you.
Yeah.
A- After undergoing this formative assessment, what do you think? I want to hear your view from the
Mhm.
questions you were asked for the listening and for what do you think about your progress so far?
Yeah, I think studying with you is the best time that I've never get uh, from other teachers. Yeah, it's actually yeah. I tell you the truth that I think I get better day by day in learning English and speaking, especially in speaking. Um, and but when studying, I think it's easy, more easy than the middle test. It's
Yeah,
very stressful.
of course. Studying
A lot
is
of question,
way
a long
easier
question.
than having the assessments because you have that worry. Am I going to do well? I'm tensed up. Will I perform well? I know there's a lot of pressure, but
Yeah.
one of the reasons why we create the assessments is not to judge you on being too fast or too slow, is to give
Mhm.
you an opportunity for you to open your mind to the progress taking place in your life. So, for
Yeah.
example, with this assessment, you know your performance, you know you
Yeah.
have improved, you know,
Okay.
you can tell where you were before and what you're
Mm.
able to do now, right? So
Yeah.
you see, the assessment is just to help you,
Mm.
you know, get to that point where you make that decision that I'm going to do
Mm.
more. I'm going to keep
Mm.
pushing. I'm going to get
Mm.
better. I'm going to
Mm.
strive to practice speaking. I will strive
Yeah.
listening. I'm going to do everything I need to do to ensure my goal is achieved. See?
Yeah.
And that's the
Yeah.
essence of the formative assessment to inspire you to do more. So I'll say
Mhm.
to you in conclusion, after this assessment, I hope you are
Yeah.
inspired to do more. And I'm super excited. We're not ending our class with this assessment. We're going to continue. So now we know I'm going to look at your work. I will
Mhm.
look at the assessments and everything. Then the decision on what, on the areas to focus on, it will be made and we will improve even more.
Yeah.
Okay?
Mm.
So good
Mm.
job
Yeah.
on your performance. Good job, good job, good job, good job. Okay, so I'm gonna allow you go because this is the second class we're having in one day. Oh my God. So
I'm
I'm
so
gonna let you
sorry
go.
because
No,
yeah,
it's
I'm so
okay.
sorry for
It's okay.
taking a lot
It's
of your
okay.
time.
No, it's okay. I enjoy doing this because um I can see the reward of your efforts and my efforts. So I don't
Yeah.
feel the strain here. I feel
Mhm.
the work we put in was worth it with the results
Yeah.
I'm seeing. I mean, I
Mm.
heard it, giving me reasons. I mean, I'm super proud. That's good. Okay, so
Yeah.
I'll allow us go back and rest. Okay. So I'm gonna see
Yeah.
you in the next. I'm gonna create the summary of
Yeah.
everything and I'll send that to you. Yeah,
Mm.
before our next class. Okay.
Yeah.
So you said you were not going to be available on Wednesday. So are you going to be available on Friday?
Friday. Yeah.
Friday. Okay, so our next class will
Okay.
be on Friday. So
Okay.
Aurora, enjoy your evening and rest well. Okay. So this is me
Thank
saying
you so
bye
much.
till on Friday.
Yeah.
Okay.
Yeah. You too.